All right, we'll call to order our regularly scheduled Assembly Housing and Homeless Committee. We'll start off with member introductions.
Karen Bronga.
Randy Solt, and then on the phone, Mr. Constant.
Here.
Mr. Martinez.
Yes, thank you.
And Mr. Littlefield.
Yes, thank you, Chair.
Okay, and then anyone else? Nope. Okay, and then let's start with other introductions. Mr. Hurt.
Matthew Hurt, Legislative Council.
Dean Gates, Assembly Council.
Farina Brown, Special Assistant to the Mayor, Homelessness and Health.
Thea Agnew-Benben, Special Assistant to the Mayor, Homelessness and Health.
Great, thank you. And before we get to the administration update, I'm just going to read our mission statement. Recenter us. So the Housing and Homeless Committee focuses on legislative, policy, and resource allocation matters related to housing and homeless in Anchorage. The committee serves as key public interface for the Assembly on issues surrounding homelessness and affordable housing in collaboration with municipal departments such as the Anchorage Health Department, Parks and Recreation, and the Anchorage Police Department. It also engages with the mayor's office, including the homelessness coordinator, to align efforts and address community needs. Always good to recenter us. Okay, so first up, we'll have administration updates, and I'll turn that over to Ms. Brown.
Thank you. I am incredibly happy to report that according to our homelessness and health strategy, we have made incredible strides in moving forward and moving the needle on how we address homelessness. In the first 100 days, we identified the launch of the HOPE team, which has been a success in its positive police engagement and the ability to link some of our most vulnerable individuals to housing and supports. And most recently, a collaborative effort with our behavioral health providers to connect people to treatment in real time. The added support of a positive engagement and relationship with APD in a proactive way with individuals that are experiencing homelessness is something that we strive to expand and do more of. But in these early phases of the work that we're doing, it has just been a positive relationship. We continue to abate camps. We talked early in the beginning during the summer about the need to really address the impact of both on the community and individuals within camps that were unsafe, some of the vulnerable folks that are being perpetrated against when a camp gets too big. So over the first 100 days, we have abated 12 camps, and with the onboarding of non-congregate, we've been able to move people, some of our most vulnerable from those camps into housing. We have stood up the first 200 beds. We are still wrapping up the confidential negotiation process with the second vendor based on feedback from the community and our assembly members to diversify the vendors that are providing non-congregate services. We have a special assembly meeting on November 26th scheduled to review that contract, which will onboard some additional resources in non-congregate to ensure that we're providing a place for people to go. We are actively working on the sheltering, warming centers, because as we know, when an individual is unhoused, there's not always a desire to go inside, but we want to ensure the life, health, and safety of all of our citizens by ensuring that there are warming centers for people to be. We really talked about early on the collaboration and partnerships that were going to be important for our success, which includes our behavioral health providers that are essential in connecting people to resources. During our first 100 days, we were able to set up a series of behavioral health work groups and started to create those relationships, which we saw dividends on in the partnership between APD and our behavioral health providers, and linking individuals from a camp that was on deck to be abated into treatment and housing. We have continued to partner with our crisis collaborative partners, and I will look to Ms. Thea Agnew-Benben to speak to the work that we're doing related to housing.
Great, thank you. We are happy to announce, so one of the big priorities that we've talked about is that as we move into our emergency cold weather shelter and move people into congregate and non-congregate, we really want to have ways for people to move out of shelter into housing. So we've been working very closely with the health department. I know Kim Rush is here with Jed and Darcy at the Community Development Division, and we've identified 3 different solicitations. One is on the streets right now. That is for some of the previous years of CDBG funding that hadn't all gone out, as well as some other federal funding sources. That one is for acquisition of housing to serve people experiencing homelessness or at risk of homelessness. So that's available right now. It can be found on the Muni website. There's about $3 million in that solicitation. We're preparing to release a second one that we're really excited about. This one, thanks to the Assembly last night approving the budget, has some general government funds in it to match some home ARP funds. That'll be, we hope, about 2.5 million. That's going to go out hopefully later this month, and that will be for operations. So that will fund, could be used for low-income rental subsidy, could be used to support permanent supportive housing, rapid rehousing, any kind of operations, not any kind, but operations that supports people moving from homelessness into housing of those types. And then we also are working closely with the administration and the state to secure some remaining funds that were appropriated for disaster relief from the 2018 earthquake. And we also will be combining some of those funds with our 2025 CDBG funding, and that will come to approximately $3 million, depending on how much we can get out of our disaster relief money, which would also go towards a capital funding for housing to address people who are experiencing homelessness or at risk of homelessness. So we're very excited to have those 3 big solicitations going out with the goal of really increasing our units and also really helping people move from our shelter into housing over the first part of 2025.
So a couple of questions. And for members on the phone, I do not have my Assembly phone. So if you want to ask a question, just please speak up at the appropriate time. 2 questions. One, I've been hearing news about Alaska DOT making abatements, which I think are rightly so because they're in there right away. And I just want to learn if we're coordinating the relocation of those people and then the other component is on capital funding. What are you thinking as far as capital funding is, like we did last time, award grants to nonprofits so they can go purchase rooms, or what, elaborate more on that?
Sure, I'll speak to abatement. Yes, we are partnering. APD is partnering with DOT on those abatements, and we have had the list of the camps that are in the right of way the DOT plans to abate so that we have the opportunity to have our outreach partners out there. The collaboration that I spoke to regarding HOPE and our behavioral health providers was specifically for the individuals that were on the 36th encampment. That is a DOT right of way that we were able to kind of really springboard what that might look like in an intensive outreach and linkage to services. So the short answer is yes. I do want to say what Thea has identified as far as the funding really demonstrates our willingness and earnestness to leverage federal dollars and other resources alongside Muni dollars so that we are expanding the availability of services and not just simply tapping one singular resource, which would be the Muni budget.
So, Member Salt, was your question who can apply for these RFPs?
Is more like what are you thinking as far as the capital? Is that part scope? Are you looking at hotels? Are we looking at pallet shelters? Are we looking at whatever?
Yeah, I think it could be any of those things. I think it could be for affordable housing, like a bigger development. It could be for acquiring a hotel and redeveloping it. It could be for redeveloping other units. It could be for something more creative. We do have some other, we're also, as part of the disaster relief funding that we're trying to secure from the state, we do have a couple other projects. You can see in our strategy where it talks about identifying and launching additional low density, low barrier year-round shelter and transitional housing. That's kind of where we were thinking about the modular units. And so we are working on that as well and hoping to potentially get some of that CDBG-DR money for that as well.
Great, thank you. Ms. Baraga.
That's exciting to hear about modular homes. When we took this trip down to Austin, it was just a veritable sea of modular homes, and they were sharp looking, and it's a way to get some housing quickly. But one question I had on the 2.5 million, maybe low income subsidies, housing, would it also, in my district, there's quite a few people that are hanging on to housing by a thread because of the condition of the housing. And would it possibly go to helping them fix up what?
Yeah,
they're
so
in?
one option for that is the health department every year with our CDBG funds grants out about 400,000 to do mobile home repairs. So that's 20,000 per project that goes out through a vendor, and people can secure support for a mobile home repair in that way. With the funding that I was speaking to, the capital funding can be reused for repair and renovations. So potentially a nonprofit or an organization that gets funded could be targeting those units. It's a little tricky when they're privately owned, so I'm not sure exactly about how that would work with that funding. But it may not be a total. It may not be totally disallowed. It would depend probably on the income level of the homeowner. Yeah. So yeah, I would want to ask Jed about that. If he just had a conflict, or else he would have been here. Yep.
Excellent, thank you. So anything else on strategy update? Okay, we'll move on to third party, I assume Kathleen? Yep, perfect. Welcome, and just state your name and off you go.
Thank you. My name is Kathleen McLaughlin. I'm the owner of Restorative and Reentry Services, and this is Emily Robinson. She's joined me in this company. Our goal under the third-party oversight is to make sure that the low-barrier shelters are being run and in an integrated, collaborative way. I don't know if you have the reports, but we are doing a weekly report. So just to set the stage, our contract was signed on October 31st, and from that time forward, we have been leaning into collaborating with all the shelter operators, Catholic Social Services, and Henning Inc., with the goal that if we integrate and collaborate and make sure that all the facilities are being used at capacity, we can do it. So everybody got stuck with Emily and I on a daily basis from November 1st on. Within 7 days, thanks to Anchorage Coalition to End Homelessness and the APD Hope team, as well as Henning Inc. and Catholic Social Services, we were able to get to capacity in about 7.5 days. And that's the 200 non-congregate. What the goal is we're setting the tone to make sure that everyone is looking at this in a positive, proactive way, real-time solutions. We have 2 meetings a week now, plus we coordinate every single morning to make sure that all beds are identified as being either filled or not filled. And if they're not filled, we immediately do a shout out on who's going to be able to take them. It is a hybrid. We take some from the coordinated entry from the Anchorage Coalition to End Homelessness. We take people from the street through the Hope, APD, other outreach organizations also. We take it by people phoning us. We have our little poster at all the shelter sites. And so clients will often encourage their friends that are still on the street to try to get in the queue. The goal is just real-time activation. And I can say that the first 14 days of this have been very, very positive. It's been a lot of hard work. What we're going to do to make sure that there is transparency is to do a 3-page weekly report to everybody. We submit it to Karina and Thea and the city manager because our contract is housed with them. And then they will distribute as needed, but we want to make sure everyone has open access. So the first 2 weeks of have been submitted, and I think that the real key is I don't know if Anchorage Coalition to End Homelessness is going to be. Oh, okay, perfect. I'll let her do the numbers, but the real cool part is that the number of individuals that were offered and received into shelter services is very startling, but it was as a result of the team concept. I cannot overestimate how important it is for us to be in communication all the time, and that is something that is so important. I would say that one of the things I am most excited about is getting more beds. As everyone probably is aware, we hit capacity, I think, at day 7, and we are basically maybe transitioning 10 people a day in between the shelters, which is just not enough. We desperately need, with this cold snap, more support. And one of the things that we are going to be doing very proactively, because it's important, is to be identifying the exits and the entrance. So when people are exiting, we need to know why they're exiting, and we need to know who we are getting in the entry and how many people are being left behind right now because we just don't have capacity. And so I am strongly encouraging everyone to think about winter is here, and we are anxiously waiting for the warming sites and the additional beds to be available. Emily, is there anything you would like to add to this?
I would just like to say thank you to everybody for leaning in, because it really has been amazing to be like, we also do emergency services with the Anchorage Safety Center, and there's often times where those clients are really the hardest to serve, and we've had places to put them almost every single day, and that's been amazing.
So if anybody wants to take a look at the report, our telephone numbers are on there. You can always, always, always get a hold of us. It's been really nice to see clients actively self-advocating for services. But I can't overstate how nice it is to have a collaborative approach this year.
Thank you. Before I'll ask for any questions from members on the phone real quick. All right. I assume these reports are being posted online in the same process as last year. So you want to remind us of what that is?
The reports will be posted on the Housing and Homelessness Committee page. The reports should be available every Friday, and there will always be a 1-week delay in the reports that you're seeing.
If I remember right, it's under the Focus on Homelessness tab, I think.
Correct, thank you. Oh,
Okay.
and I'm sorry, they will also be hyperlinked to the AHD Housing and Homelessness website as well.
And Ms. McLaughlin, just looking at your recommendations, they look pretty minor so far. It looks like it's just typical startup nips and tucks here and there. So that sounds like we're off to a decent start.
My view is that everybody is doing the very best they can. And we are taking things that are most urgent, which is getting people into beds. Now we're going to start shoring up the processes, such as the transportation, the interplay between the various shelters. So we did the first thing, which was urgent, was get people inside. And now we'll start shoring up those processes. But you're correct that it has gone a lot smoother than I expected.
And I think obviously we need beds, but warming space is needed. Do we have a quick update on what we have and we plan on having for warming spaces?
I am very optimistic that we will see the invitations to bid posted this week for warming.
Fair enough. Thank you. Yes, Ms. Braga.
Kathleen, last year, I haven't been over to the CWS site, but they intaked right in the room where all the people are. Have they made any change with that? It seemed really chaotic to have people coming in and out where beds were. Besides, it was kind of cold to have the door opening all the time.
Through the chair. So one of the challenges that we have at CSS is that their caseworkers have not been put into action. They haven't been operationalized yet. So right now, the process is relatively simple. It's a check-in through security and then for the attendance or the capacity right there, which it needs to be. Other than that, hopefully when the case managers do come on board, there will be more diversity and use of space in different areas. Because I totally agree with you, you know, we shouldn't be case managing from in the front of a door that's got some chilly air coming through.
They also cleared out their back office for those meetings. Yeah.
Okay, anything else for RRS? Okay, next item, ACH update on outreach and CE for shelter launch. It's Parks.
All right. Hello. Thank you for having me here. My name is Jessica Parks. I'm the Chief Operating Officer at the Anchorage Coalition and Homelessness. And I'm not going to repeat anything that Kathleen or Thea or Farina shared about this, but I did want to talk a little bit about this process and how we were able to leverage the investments that have been made in outreach and coordinated entry to be able to make this process not just a smooth process or smooth-ish process, but really reach our goal of ensuring that the most vulnerable people who were outside were able to get access to those beds and come inside. So I've been tracking this over these first 3 weeks that the shelters have been open, and I'm calling it a little bit of cold weather shelter by the numbers. But I just wanted to highlight in these first 3 weeks, we served 325 people in those 200 beds. So we did have people who came in, accessed the shelter just for the period of time that they needed to. For some of those people, it has been the entire 3 weeks. For some of those people, it may have just been a day or two. Out of those 325 people, we had 21% of them, or 70 people, that were over the age of 55. So we really did accomplish a goal of ensuring that people who were older and more vulnerable had access to that shelter. We also had many people with disabling conditions, and these are duplicative, but I wanted to highlight that 161 of those 325, or 50%, had 3 or more disabling conditions when they came into the shelter. So I just want to highlight that for people. That was one of our goals. We wanted to ensure that the people who were the most vulnerable had access to these shelter beds, and I think the numbers are showing that's what happened. We only had 37 people access shelter that had 0 disabilities. So that is a very small portion of the people who access shelter in these first 3 weeks. And then the last stat I think I want to highlight for people is of those 325 people, 301 of them came from a homeless situation. So we didn't have people who were leaving housing to get a free hotel room. That's not what happened. We had people who came from either a place, what we call a place not meant for human habitation. So that means they are outside, they're in a car, they're in a shed. They're, some place that is not meant to be lived in. 220 of those 325 came directly from a place like that. And then we had another 81 people who came from another shelter. So as they were, as Kathleen and Emily shared, part of this process has been creating flow in other shelters as well. So transferring people between shelters. The rounding out of the 325, we had 5 people come directly from a hospital. And then we had 19 people who came from some type of transitional or temporary situation, like a transitional housing program or staying with a friend or family, or had been staying in a different hotel or motel. So we just call those, they're temporary. It's not housing, but it's not outside. And then right now we do have, or we have had 13 veterans accessing shelter as well. 9 of those 13 were over the age of 55. So those are connections that the shelter staff are able to make to the VA or to CSS's Supportive Services for Veterans Families program that exist right now, which is able to connect them with other resources. So when we're able to identify things like that, when someone comes into shelter, we're able to very quickly navigate them into some of those other resources. And then the last thing I want to highlight about the importance of leveraging outreach and coordinated entry in this is that we know that the people who are at the top of that coordinated entry list are the ones who are going to get those housing referrals. That's how our system works when it comes to those programs. So by making sure that the people who are at the top of that list and the most vulnerable are in shelter, when they get those housing referrals, that will naturally create that flow. So even if we don't have any very quick investments into housing solutions that will create that flow, by prioritizing people at the top, we'll create that flow naturally and be able to provide them shelter and provide them some assistance with getting document ready, getting IDs, anything that they might need from that shelter, and then move very quickly into that housing resource when it becomes available.
Great. Thank you for the update. Are you seeing many, just some things from last year, families or children and pets?
Yeah, so pets have been the ongoing challenge. If you've been part of any of the meetings over these first 3 weeks, it does start to feel a bit like a broken record. We have had a lot of people turn down the shelter because of pets. Right now, the only shelter that allows pets in our community is the shelter at 56th Avenue. So you can take a pet there. All of the shelters do allow service animals. That's compliance with ADA, so they have to. So if they have a service animal, that's a different situation. They can go into shelter, and we do have people with service animals in probably every shelter in town right now, but definitely in the non-congregate sites. We have a few people with a service animal. Families, we have had encounters with some families. We do have a really good family cold weather shelter program that was stood up actually October 1st. So it's been in operations for a month and a half, almost 2 months now. And we're able to make those referrals very quickly. So when we do encounter a family that's outside, they have a resource that night. There has not been any capacity issues with the family shelter.
Great, great. Thank you. Members on the phone, any questions? All right, and thank you. And now we moved our data updates to quarterly, so we'll look forward to that at the appropriate time. Thank you. Okay, next we'll move on to library update on community resource coordinators. Ms. Nikolai? Again, state your name and who you're with.
My name is Elizabeth Nikolai, and I'm the acting director of the Anchorage Public Library. As many of you are aware, beginning from 2018 to about 2022, the library had a social worker program that was variously funded by grants and then later by alcohol tax. Those positions have been vacated or not under library supervision since around 2022. As we were reflecting on that program, we have decided that as we bring this program back, instead of hiring social workers again, we are hiring what we are calling community resource coordinators. The problem with the social worker program was very successful in many ways, but it was also very difficult for us to manage as librarians, as our expertise is not social work, and nor is that within the scope and the mission of a traditional library services. What we are very, very good at is information resources, and that is within our scope and mission. And so we are planning, and in the budget that was passed last night, the funding for these positions have been moved from the alcohol tax into the general operating fund. We are planning a community resource teams that will be led by an outreach librarian with 2 associates working with her or him. And they will be working together to coordinate information resources from the community as far as like availability of resources, both creating as needed physical things as well as programs, bringing in housing labs, job labs, coordinating SNAP signups, benefit signups, Medicaid table signups within libraries. So bringing the resources from our community into our buildings and the patrons who are there, as well as taking the library resources that can be a benefit. We have job training resources and many other things, and taking those out into the community where our residents are who will need those things. And so they will be coordinating this bi-directional flow of information resources, working with our partners at the health department and our partners in the nonprofit space to make sure that we are gathering and distributing the appropriate resources, as well as doing direct services to the patrons in our library. One of the things that we find our unhoused and at-risk patrons need most are people who can sit with them and fill out a form. And so that will be a lot of this, because every form is currently online and that can be very difficult if you have low English level skills, you have low computer literacy. So someone who can sit and spend the time to help you fill out a rental form or social worker. So the program will be of direct service to our unhoused residents, both in the libraries and outside the libraries. I have come today just to share this update, and so that as we move forward, it will not be direct case management or social workers, and we are focusing on the scope and the mission of the library and really coordinating that information resources.
Thank you. Any questions on the phone?
Mr. Salt, I have a quick question.
Yes, Mr. Constant?
Yeah, thank you. Elizabeth, thanks for that update. I think that that program shift to kind of resource providers, like giving information, is a little bit outside of the scope of what the intention was. I don't think it's a bad thing per se, but I think you're going to need to identify somebody to consult who actually does have social work background, right? So, or clinical in some way, so that you can ensure that what's happening is clinically appropriate.
Thank you, Member Constant. We have every intention as we do this to work with our partners at the health department. I have been working with Director Rash on this plan as we go along. And our hope is to have our staff be trained by them and in turn be able to potentially facilitate some of their staff having office hours within the library as their staffing is available. To make sure that we are working within best clinical practices. One of the difficulties in the previous iterations is that as librarians, we don't have that expertise. So as we were hiring social workers, we had no way to evaluate if they were being successful at best clinical practices because that was so outside the scope of our expertise. So we're hoping that when we work within our experts and are able to bring in the actual social workers to do coordinated entry at the library as a table, as a program, and we are using these staff members to help coordinate that effort.
Yeah, I think that's all reasonable. I just want to make sure there's some kind of clinical alignment there.
Great. Thank you. Member Baronga?
I think this sounds like a terrific direction that you're headed. One question I had is, do you do something like outreach at any of the shelters, like a bookmobile kind of thing, or somebody come and do reading or anything like that? It seems like a really bleak place, and activities would be really nice.
Member Bronca, we have done some in the past. It's been limited by staff availability, and that will be at a high priority. Currently, we have our early literacy outreach librarian who has done outreach story times and events at Clare House. We also maintain early literacy stations that we fill with books and other like tips and cards about how to like interact in literacy fulfilling ways with children at all WIC offices as well. So we're hoping to continue to build on some of those efforts.
Catching the adults would be great too.
Absolutely.
Thanks, Mr. Nikolai. The library is a great system and is used as a warming shelter by our homeless population. And I like to see how you're adapting and sticking within your swim lane, which is for the resources that are needed. Question I have is, when you talk to the library, I think of the LUSAC, I assume that you're doing this at the other branches as well.
Absolutely. We expect that these positions might have offices at LUSAC, but we do expect them to be at all of our locations.
Great. Any other questions for Ms. Nicolai? Okay, thank you.
Thank you.
Okay, and as we mentioned, the ACH data update has been moved to quarterly, so we'll have that in a future meeting. And then upcoming funding opportunities for housing and shelter. I think, if any more, I think you kind of covered that. Excellent. So that'll bring us to behavioral health provider coordination.
Great, thank you. So as Farina mentioned, one of our first 100 days activities was to establish a work group of behavioral health providers and also other healthcare providers, because oftentimes behavioral health is provided at a primary care location. Sometimes behavioral health providers also have primary care available. So, and some of our large organizations, of course, do many different levels of care. So we really wanted to bring together, the provider community in Anchorage, and also extending up to the Mat-Su, because there's some great providers there who are interested and willing to come down and kind of share their expertise, but also potentially share their resources with folks living here. What we've found is that oftentimes behavioral health care can be hard for people to access, especially if you aren't housed or you don't have the support to kind of help you navigate the system. And so we have had 3 meetings with this work group, and we had more folks coming each time. So we regularly had about between 40 and 50 folks in the room. We hosted them at the training rooms at Alaska Housing, which is a really nice big room. So we were able to do some facilitated activities with the group. And together, we really tried to map out the document that you see here. Maybe you could pull it up. And I put some printed copies over there. We really tried to map out what are the steps along that pathway to really access behavioral health care, and who are our resources and providers along each of these steps. And so we, as a group, we kind of brainstormed the resources, and then I went away and did some more research and kind of ground truth things as well. And then, as you see, this says working draft, please send corrections to me, because we want to keep iterating this. We know that there's going to be folks that we've missed or information that isn't clear on here. But I think the overall takeaway that I just want to share is that we do have a pretty robust and very skilled and caring group of behavioral health providers in our community. And, people can access them at different points. So you'll see that, like, the second one here is crisis care. The first one, outreach and engagement, we do have some drop-in locations. For example, the Pier Lounge that Alaska Behavioral Health operates, of course, our Third Avenue Resource and Navigation Center. If you're someone who's between the ages of 18 and 24, Covenant House is available. So just wanting to make it clear that we do have these resources available, and that they can then help people move through the rest of these steps to get to the level of care that they need. And I just want to emphasize one additional thing. If you look on the column that's has 3 at the top, so this is assessment, treatment planning, and then MAT stands for medication assisted treatment. So someone who's experiencing active addiction, whether that's to alcohol or to opioids, and sometimes other substances, we have very effective treatments now that combine medication with counseling and support. And when someone's in withdrawal or starting to go into withdrawal, there's no way that they can, be in the part of their brain that would allow them to kind of think about the future. And so oftentimes accessing that medication is a really good way to begin to move through that withdrawal process, and then figure out what next steps would be appropriate. And I think if you just flip the page there, that column 3 goes halfway through the next page. So I guess what I want to emphasize is that there are lots of providers that are open for business. I feel like we haven't always kind of made that clear, or maybe even had that the benefit of those organizations, and that these are resources that are available in the community. On the third page, I tried to kind of do the flip, which is what are our shelter and housing resources? Because sometimes healthcare providers don't know how to access those. So on that third page, you'll see the steps are really more around services to address the homelessness itself. So how do you kind of enter into that system? How do you get on the coordinated entry list? How do you find emergency shelter? How do you access employment, benefits, training? And then what kinds of permanent supportive housing or other types of supportive living are available to us? So this is something we'll be continuing to update. Our next steps from here is really to do some smaller groups. So for example, this week, we're trying to figure out some barriers for people who are in hospitals getting discharged into residential treatment when that's where they want to go. So we'll be pulling some smaller groups together around particular areas where we know we have gaps or barriers. Rena, do you want to add?
I think with the document that Thea has identified really is, when we think about how do we utilize this, it is really informational. I want to acknowledge that handing this to a person that is in crisis is likely not going to be the most beneficial way. And so I feel kind of compelled to say that it is a document really for our community members, for providers in multiple different spaces. And when someone is in that capacity, as Thea identified, that where I'm able to think about what are those pieces maybe for a family member, this is where this type of information becomes very critical to have on hand, and understand that as all of these partners came to the table, there's still going to be their requirements for each of their programming. We had a number of providers that said, hey, we have capacity for some immediate access and this is what it looks like. But I just want to ensure that we're couching this information in the best way to use the navigation, and understanding that every single organization has a very specific criteria and who they serve. And the willingness to be at the table is, if we can't serve you, there's someone else that is, and how do we create that warm partnership?
Any questions on the phone? Okay, Ms. Baranga?
I think this is incredible. I can't believe how many times somebody mentions some program that I've never heard of. And by getting this list continuously updated, it's just an incredible resource that I thank you much for that.
I got one question or two questions for you. So I assume everyone on this list will eventually have a copy of this list. So if I call the
They
wrong
do.
member, they can help triage.
They do.
Perfect. And then I don't know where to start. So what do I do? I am someone that's homeless, that's experiencing issues. One call does it all. Where do I start?
Yeah, I think where we've been sending people, so some of those resources go to people. So for example, the Hope team and the outreach partners, Jessica's a huge piece of that, have been meeting and coordinating their efforts, and they're using as people know, if you go on the Muni website, there's a map of camps because people report camps. So they're using not the public layer of that, but another layer of that to really coordinate their outreach and making sure that we're actually visiting as many of those camps as we can. And for example, if we find, oh, this one has young people in it, Covenant House should really go there, like making sure they have that information. So some of it is we're going out to folks. In terms of where, if you run into someone, where can you send them? The Third Avenue Resource and Navigation Center is a wonderful place to go. So is the Pier Lounge. If you're trying to access care over the phone, 211 is a 24/7 resource. It's also a website. And then of course, Covenant House is also open and available. And then some of these other ones, I would really encourage people to reach out to them. For example, when we were in our last work group meeting, Rural Cap said, we have housing available. It's not necessarily our PSH, our permanent supportive housing, but if someone has a little bit of income, they probably can get into some of our units. And so, just by knowing that it's worth trying, to reach out and see, like, is there a unit here? So I think this, just like Farina was saying, this is primarily probably useful for case managers and people helping other people navigate, whether that's your friend, your family member. But if you are an individual, I think that we really send people to the Third Avenue, the Pier Lounge, and then also, of course, calling 211.
Thank you. That's perfect. Ms. Braga?
So that made me think of, I got that email from a woman that had found someone in pajamas near the Third Avenue Nav Center in the evening. And, you know, it's got, I think it says 10 to 4 on here, but I think it's 8 to 3 now or something like that. And she didn't want to take them to the emergency room, you know, just wondered, where can I bring them? So where do we find the bed when it's past navigation center time? Is it 311 call? Okay.
Member Branca, I've asked Kathleen to come back up because the after-hours resource is something that Restorative Reentry has really leaned into as a part of the work that they do. And so, Kathleen?
So what we are doing right now is RS has a 24/7 telephone number. And so we are taking calls all the time. And what we're doing, and it's really important, is for people to do soft handoffs. And usually we can find some safe place for individuals. It's usually a stopgap before they get into the shelter, or it may be something that we just kind of fly by the seat of our pants just to get them inside. But usually there is a community member who is willing to do something.
And a part of that can also include, are there some tangible resources that we can give? Because sometimes individuals that have been on the street just need some of the resources that, yes, being inside is the solution into what we want to do, but can we give you a blanket? Can we give you a jacket? Can we give you shoes to get you through the night, to then get you connected to one of the kind of step one places that Thea spoke to, and the connection through RRS?
Thanks again. I really appreciate this. I think we're getting closer to communicating what our response network looks like, the matrix organization that we talk about looks like. Again, educating the assembly members, the public, the staff, and hopefully whatever number I call on here, they're gonna, instead of telling me, well, we don't do that, they'll say, well, we don't do that, but try calling one of these. And that's perfect, because I hear that a lot from citizens that I tried calling all these numbers, no one can help me. So thank you. This is awesome. Also point out, again, your first sheet, the first 100 days, really appreciate all your boxes are checked. I like the roadmap, like the plan. Okay, so that brings, anything else before we move on to health department? Okay, health department's easy. Health department is in the house. We talked before the meeting to Director Rash. There is no update, so I will check, confirmed, and we'll move on to public comment. I know of one so far, 2. Okay, please come up, state your name, and you'll have 3 minutes.
Block. So I'll let you know when my 3 minutes is up.
Honor system.
Okay. I bought the book, ABC's of Democracy. It's not only for children, but 3 minutes of my democracy is going to be on bringing forth an issue which you all got copies of. Was a discovery of a person. I'm Ronald Leva, adjacent property owner to the Brother Francis shelter. Friday morning, there's a gentleman, the hill goes down, a ditch goes down to my fence. He was hung on the fence, no hat, no gloves, no shoes, and in pajamas. My employees called 911. The response was quick, flagged down a policeman. And fast forwarding, the question is, where did this person come from? And in the past, I've reported the release of vulnerable individuals, which just was noted that over half the population has mental issues or disabilities. So when they go into the shelter specifically, so I believe that was the closest shelter. You can't, it's not a prison. So you can leave, but sometimes you can't go back in. But if you leave, they should be monitored that they're properly clothed, meaning, you know, do they have hats, gloves, proper clothing? It was 6 degrees that morning, and I don't know if that guy lost his hands, feet, toes, whatever, or is he dead? But this isn't the first incident that I've reported. There's been other incidences, even in the summer. The shelter is required in interconditional use to pick up garbage. Ask them for that report. They have a good neighbor policy. Ask them for the form that's filled out. They don't have it. And if they have it, it's toilet paper. And that's the best use for that policy because it's ineffective. Their license was granted protest. I never got an answer. Whatever you do, don't give them any money without accountability. Now, I have quite a few other things to mention, but the shelter has a population of 120. Their cap is 240. The navigation center has limited hours. Who's going to call a number in the middle of the night when you don't have a phone? It's almost ridiculous. And those policies should be monitored. If you hired an oversight person, make sure you do that. Now I'm going to fast forward, add to the list here of health providers, the chaplains. I asked for money for the chaplains. They're very important, very effective in mental health and in crisis, including my own. So make sure you add that. I also asked for money for Hydrants for Hope. Is that my 3 minutes? I think you're counting by twos. Get that clock adjusted. Okay, well, thank you. And I know there's other issues I could bring up, like Chugiak. These people, if you understand transformers, they give off heat. And they have a big issue with homeless along the transformers, but we should do something working with them to report when people are found next to the transformers.
Thanks, Mr. Oliva.
Sure.
I know notes were taken, so I'm sure that we'll follow up on those two issues you brought up. Thank you.
Well, thank you very much. I might as well ask, are there any questions? Mr. Gates, do you have a question?
Thanks, Ron.
Stay safe and have a good day.
Okay, state your name and what part of town you're from.
Sorry about that. I'm Miss Sophia O'Neill from the Eagle River. This is going to be along the lines of what I presented in front of Assembly before. I wasn't able to go last night. When I gave examples of what it meant and what it was like to be poor in Alaska, from things I experienced and from things people told me, I hope this helps keep everyone very motivated. When you are in the cold, knowing there is nowhere to go, the mind has a way of making the situation even harder. Depending on your thoughts, nutrition, hydration, your heart rate, all play a huge role in whether you survive. Your body needs food to burn for energy, to keep you warm, and your body needs hydration because it's working so hard to keep you alive. Your heart beats, your body sweats, and exhaustion or wind suddenly cool you, and then the stages of hypothermia set in. First you're hot, then you sweat, then you plummet to a cold where the ache is to your core. The pain of its onset is a needle-like pain that resonates, and the cold shivers your skin and turns your skin to a clay white. You can barely move, and then Charlie horses set in. Any athlete knows what that is. Your ears and your jaws hurt. Your lungs burn, and if you have to pee, depending on how hydrated you are and whether or not you have somewhere to go, your body just goes, making you even colder. If you make it through the cold, you are rejected from entering anywhere because of the stench of urine. You don't have to drink or be on drugs for this to happen. It happens because the body is dedicated all of its energy to keeping you warm, and elimination is a part of it. Read about it. The factors that keep people outside aren't at the point of bringing homelessness to an end. How can anyone allow demoralization and pushing one away into the cold or assign judgment? I heard someone say the other day, they made their choices. Now let them live or die with them and accept their consequences. Please don't quit or allow eventual complacency because the situation is hard to solve. Thank you.
Thank you, Ms. O'Neill.
Hi, Roger Branson, formerly of Eagle River, currently in a transitional state, staying in a motel that's very challenging for me. But I want to remind everybody just how broken of a system that we've had in the past and just how far we have come in mental health understanding and challenges for these last 30, 40 years. And we have come a long ways, but we have never acknowledged how broken the system was, how damaged some of the individuals became because of that, and how the little nuances and how the services are provided today end up reinforcing that brokenness instead of helping the individuals heal. I tried really hard during Centennial Camp to be a positive resource, to be someone that could provide hope and encouragement to the people who are experiencing homelessness, to find pathways to their healing, to their recovery. And just framing it as a homeless issue and trying to solve homelessness does nothing to fix the brokenness that these people have experienced. And yet we can change something today. We can do a new policy, but it still does not address that brokenness. And for all my good efforts in Centennial, you know, some of the stigmas that have followed me through my life came back to life and made it so that my efforts to be a positive model for these folks to move through into their recoveries, to figure out what's next for them in life, because that's really the heart of the issue. And to figure out that there is something next for them in this life other than constant reinforcement of the traumas and the wounds that they've experienced in the past. Unless and until we decide to address that, unless and until we decide to start supporting and helping the people who are in the camps, trying to help the other campers lift themselves up, we're just chasing our tail. And yeah, I'm sure it feels good to some, but for the people who are experiencing hopelessness, for the people who are still caught in those past traumas, not acknowledging them, not allowing them space to heal, and allowing this community condemnation to just run unchecked is very detrimental to our efforts moving forward. And I do believe we're at the threshold of really helping some of these folks out, but we can't continue to use the stick and deny the carrot. Thank you for your time.
Thank you, Roger. Any other public comment? Yes, ma'am. Welcome. State your name, what part of the city you're from.
My name is Betsy Baker. I am from the Lake Hood neighborhood, and I'm on the board of In Our Backyard. And wanted first to thank the Assembly for the funding through the Health Department that we received last night at the meeting. And we are very grateful for that to start our operations. We will be meeting with potential guests this week and next. And so we are close to launching and just wanted people to know that. But above all, I wanted to thank everybody in the room. And it is very, very true that this does not happen but for you and the amount of collaboration and support we've received, and looking around the room, the new friends and acquaintances we've made over the past year as we work for this really does give me hope. I do want to thank Ms. O'Neill for her very true and hard and important facts that she does share with us, and that we are hoping to be part of a small part of the solution, keeping those things in sight. And really just wanted to thank the community and the Assembly and people gathered here.
So Ms. Baker, I'm not familiar with In Our Backyard. Can you tell me what it is?
For those who aren't, it's a small project for unhoused seniors. And we will be welcoming up to 7 people in the next month. Sort of over time, we're not going to have everybody move in right at once. These are very tiny transitional modular units, or cabins as we're calling them. And we are hoping that people will be able to move through In Our Backyard into permanent housing. We'll be working on site with Catholic Social Services is providing caseworkers. And we will have site managers with the help of RRS. And the goal is to have people stay 6 to 9 months and have a quiet, private, lockable unit that's heated, where they can go out and come back and know their things will still be there and they have a safe place to sleep. And we have a shower trailer and bath available on site. And I think very importantly, a large network of community volunteers to provide that welcome and help with filling things out on the computer and whatever other wraparound services we can be a part of. Thank you.
Thank you. Anyone else? Welcome. Please state your name and what part of municipality you're from.
Excuse me, under the weather. Jamie Lupus, East Anchorage, formerly Coalition. No prepared remarks today, so I'm just kind of winging it. I listened to some of the presentation here today, and unfortunately, I missed some of it. There was discussion about pets. Obviously, there are lots and lots and lots of pets out there. I was feeding a tremendous amount of pets at one particular camp recently, so yeah, there are barriers obviously to get housing, and there are people that look at these pets naturally like their children and their emotional attachments. And sometimes I've come across pets or people that I just can't understand how the heck they are there. And then I come to find out that, they've got 3 pets and they can't get into an apartment. There was a woman named Azalea last year over at Cuddy, and, Christian devout, and she had these 3 pets, and, I got to know her over a period of time, and it was one of these things where, one that stands out there and I just can't get it. But there's lots of things like that. And so basically, Hope Team, they showed up at one of these pet events recently, and unfortunately it was one of the things where they went plain clothes. They started going into snow dump, and somebody said, I don't talk to police. I don't talk to police. Talking to the Hope Team sometimes can make a mark on you where it becomes a danger. And so I was trying to say, please don't invite these people. They did. I don't have access to pet food to take to these people at all hours. And so hopefully somebody can resolve that situation, because there are 50 plus pets over at one particular camp. And that one worked out. As far as families, there's families that are out there that still haven't been housed. I know some of them. And they're complex situations. The keeping people alive argument that the Miss talked about back here. Yeah, I've come across a number of things where, I'm taking food to people to prevent them from going into areas and potentially stealing, or just to stay alive. And I'm still doing it now. And most of the providers, they don't go past 4 p.m. If you go at night, some of these RVs and tents are packed like clown cars, because to prevent frostbite or death, you do what you do, and then it's either you freeze or you pay for propane and risk carbon monoxide poisoning and infections. I saw that happen to people a lot of the times. They can't get medical care as well. Just not having access to water. Someone got kidney stones. It was inoperable. They had to essentially go and get surgery, and then you get stuck with a bill. I don't know if the community is willing to discuss this. I've been trying to get people to discuss it, but there are hundreds and hundreds of people that are outside right now. I think Jessica said the number was 350 that went through non-congregate, and 475 was the number for total and sheltered. HMIS, the 475 number is the floor, not the ceiling, and it is much higher. And people right now are getting kicked out of non-congregate for stupid reasons, and there needs to be a way to get them back in. I talked to Ms. McClellan yesterday about one of them when I come across somebody at New Hope. And so obviously, I could talk about this a while, but I'm still waiting for somebody who wants to have a discussion. So thank you very much for your time.
Great. Thank you for your comments.
Yep.
Anyone else? Okay, with that, we are adjourned. Thank you.